Local therapy of the primary breast mass in patients with metastatic disease. So the role of local treatment of the primary breast mass and or the axillary lymph nodes is really for symptom relief. So some of the symptoms are pain, bleeding, lymphedema or swelling of the breast or arm, infection or poor wound healing caused by the breast mass. Sometimes you will have symptoms of arm weakness or sensory loss, and that can lead to issues because of the compression of the nerves under the arms or the brachial plexus. And so all of these symptoms are reasons for considering local therapy for the primary breast mass in patients with metastatic disease. Local therapy of the primary breast mass in patients with metastatic disease, the goal is to decrease the local disease burden and cause symptom relief. Many times this can be achieved with systemic therapy alone, but other times we will use radiation therapy or surgery. And sometimes radiation can be given before or after systemic therapy, and sometimes it's given with radiation, systemic therapy and radiation together. Surgery can be a palliative mastectomy or lumpectomy may also be used. So if the patient is asymptomatic, then local therapies such as radiation therapy and surgery are not typically given as standard of care due to the lack of evidence showing that this improves survival. But there can be exceptions made case by case in a multidisciplinary setting. And these decisions need to include a very thorough discussion with the patient and also consider patient preferences. So some examples of these case-by-case discussions would be, an example would be in HER2 positive breast cancer and someone with a dramatic treatment response in the body that has been stable over a prolonged period of time, greater than 6 months or a year, but there is progression of disease in the primary breast lesion. Or if a patient with a very large breast mass that may be ulcerating and breaking through the skin, and the concern is that the systemic therapy will not lead to shrinkage of the disease before it ulcerates through the skin. So these two examples are reasons when primary breast resection may be considered.